Connie's, brace yourself. Could butter shorten our lifespan? Researchers at Brigham and Women's Hospital in Boston tracked 220,000 people for 30 years. Those who ate the most butter were at the highest risk of premature death compared to those who opted for plant-based oils like canola or olive. Joining us to talk about this, it's Dr. Jeff Pothof, UW Health Chief Quality Officer. Doctor, great to see you. This is terrible news for Wisconsin. Tell us about this study.
It's terrible news, but it's one of those things that, like, deep down we know it's true. We just don't want it to be true. But butter is not a health food. It's not good for you, even though it's delicious. Now, I think the good news on this survey is it was the people who answered on the higher end of how often they eat butter. And the response for that could be, 6 or more times per day. I think we can all agree that that's too much butter.
That's a lot of butter.
But in general, we've got to decrease our butter consumption, switch to those healthier oils, which are soy, canola, olive oil, if we want to live longer.
You know what's interesting, though, because they said a lot of the study's focus was on the plant-based oils. They're just basically saying that's better for you. I always think of those butters as fake butter. Is it time for me to recalibrate my thinking?
No, it totally is fake butter, but fake butter's better for you than real butter.
Oh. Like maple syrup, fake maple syrup, that's really bad for you because who knows what that is. But fake butter, I mean, it is interesting. It's all plant-based. You don't think about that, because they don't say this is plant-based butter. That's never the name of the brand you're buying.
Yeah, no one wants soybean butter. They just want butter.
Right. The question I did have, how much butter can we eat? I thought it was interesting. The researchers, they really couldn't answer that.
No, this survey isn't really set to do that, except for, the more you eat, the higher your risk is. The less you eat, the lower your risk is. I think the good news there is, like, some butter is maybe okay, but a lot of butter probably isn't.
I won't have that 7th tablespoon of butter because I will know that's bad for me. Okay, let's switch gears here because this has been making a lot of headlines. The death of Gene Hackman and his wife. It's just so tragic what happened. We know she died of hantavirus, and that was a virus, doctor, I had never heard about. What is that? How deadly is it usually?
Yeah, I think you and a lot of other people, especially those who live in Wisconsin, have never heard of this. So it's a virus that is often carried by mice. And we do have the right mice up here in Wisconsin. It's deer mice, white-footed mice. There's a bunch of different mice, apparently, but it's rare up here. So since 1993, there's only been 5 cases in Wisconsin. Down in the 4 corners area, Colorado, New Mexico, Arizona, this is a bit more common. It starts out like any viral infection, fever, you feel kind of crummy, nausea, vomiting, abdominal pain. But unfortunately, what then comes on is a dry cough. And then you start to get, worsening cough. Your lungs start to fill up with a bit of fluid, and it has a 20 to 30% mortality rate. So it's pretty dangerous. Best word of advice is, don't play with mice. And if you have mice in your house, this is one of the more important reasons to get them exterminated, even though in Wisconsin, this is fairly rare to find in mice.
Yeah, do you need a lot of mice droppings to catch this virus? I mean, or could it happen with just like one mouse who happens to be through your house really quickly?
We don't know because the disease is so rare, but I think, the closer you are to contacting mice or being in touch with their feces or their saliva, the more likely you could contract it. The risk tends to be when we see outbreaks, it's typically in facilities that have a mouse infestation. So more mice seems to be more risk than a single mouse.
Yeah, very interesting. All right, Dr. Jeff Pothof, we appreciate your time for coming on the show again.
Thank you.